On today's episode of Melanated Conversations, we amplify the voice of Dr. Kortney Floyd James. Dr. Kortney Floyd James is a nurse scientist and pediatric nurse practitioner. With an extensive background in leadership, public health policy, and primary care as a pediatric nurse practitioner, Dr. Floyd James began research interests related to maternal-child health disparities while practicing as a pediatric nurse practitioner in a well-baby nursery in a postpartum unit. Listen in as Dr. Kortney shares her expertise and research findings in the exploration of racial identity in Black mothers and how they may influence their maternal functioning and their risk for postpartum depression. Welcome to Melanated Conversations, our narrative from our perspective.
Here on the podcast, we are amplifying the voices of Black women and sharing their powerful stories of transformation.
I'm Tyrion.
And I'm Yana. Let's start the show.
Welcome back to another episode of Melanated Conversations. I am your co-host, Tyrion.
And I'm your co-host, Yana.
Yes, and so welcome back, guys. We're back for another episode in season 3, and we've got a special guest with us today, Dr. Kortney Floyd James, and we are just going to be having some wonderful conversation with her, talking about all sorts of wonderful things, or not wonderful things, but important things as far as healthcare for Black women and mothers, all the things. And so welcome, Dr. Kortney James. Thank you for joining us today.
Thank you. Thank you for having me. Thank you.
Of course. Would you remind you prefer us to call you Dr. Kortney, Dr. James, or just doctor?
Whatever, pleases you, long as you say the doctor.
Oh, yeah, you got it. I was going to say, you earned it. You earned it. So we're going to make sure we show respect.
Oh, you're fine. I know Dr. Kortney Floyd James is a mouthful. I'm recently married, so I tried to, use it for a little while, but it'll probably just shorten to Dr. Kortney James. So you can call me Kortney, Dr. James, Dr. Kortney, whatever. Whatever comes out is fine.
Well, whatever we will say, please say the doctor.
Please say the doctor.
Congrats to you.
Yeah, congratulations.
Thank you.
Oh, well, you guys, as always, before we get into our melanated chat, we always like to play a fun round of what we used to call rapid fire. We have now changed the name to Don't Drop the Mic. Okay. So, Dr. Kortney, would you like to play a couple of rounds with us?
Of course.
Okay. So now we can kick it off. Yes.
Yeah. So we'll answer these as well. I'm just going to throw out, I don't know. I'm going to throw out one question, maybe one question for today. Yeah. So my question that I have for you guys is, what's a word that people use now that you weren't allowed to use back in the day at grandma's house?
Oh, it's so many. But I would say, why?
Ooh,
you could not ask why.
And
if you did, it was because I said so.
Mm-hmm.
And I think that was good enough for us because we weren't like these empowered youth nowadays or I would say these evolved parents and their empowered youth who give explanations. Like I'm that parent now, I give explanations. Not that I feel like I need to explain myself, but just to make my daughter inquisitive and empowered to ask questions. So I do explain certain things, but I think why.
That's a good one. I actually didn't even think about that, but that is legit. That is so legit.
That word is still
right. I'm a grown woman. I can't ask my mom why.
No,
mama, granny, nobody.
Right, nobody.
No one. And it's funny because I'm the same way with my girls too now, Dr. Kortney, where, I try to explain things to them or give them explanations. Same reason, like not to just accept an answer from anybody, although it's different, obviously being their parent, but just to get them in the, in the habit of, you still want to question. You just don't take everybody for whatever they're saying and go with it. Right. But yeah, why? That's a good one. I think for me, and I'm not going to say because I don't necessarily use it, but I just hear people use it a lot more.
I think you're about to say my word. Go ahead.
Sorry.
The word I'm thinking anyway.
Okay. Shut up.
Because one thing, I don't know if you know, Dr. Kortney, we're first cousins. So we had the same
experience.
Yes.
So I'm interested to see what Tyrion is about to say.
Yeah. No, my word is shut up. You just don't say shut up. It was just it's a nasty little word.
It's a
nasty word.
Yeah,
you can say hush. Say hush or be quiet, but you better not say shut up.
Better not.
Better looking at the stars and
man.
Okay.
Because you will get.
I tell my daughter that now. I don't even want to hear you talking to your friend that say shut up. Like you're not grown. You don't say that.
Yep.
And I feel like my mom and my grandmom at the same time. And I'd be like, ooh.
Man, that is real. That's real.
Okay.
What about you?
Me, this word still gives me trauma to this day. I find myself and I get ready to say it. I'm like, ooh, my grandma and mama ain't even present in the room. I just feel like, oh gosh, I can't say that. So it's kind of like gotten to the point where my girls don't say it either. Or if they do say it, I kind of look like, I'm like, okay. It's just been embedded lie.
Yeah.
Oh yeah.
Yes.
Girl.
Yes.
Them 3 words.
Yes.
L-I-E.
You cannot.
You better not say you a lie. You a what?
You a what?
Who you think you're talking to?
That part. Who you talking to?
Now we could say fib.
Or telling
or telling a story.
Right. Yeah. But you better not say lie. That's a good one.
Cuss word. Yeah, how did that become?
What, lie?
Yeah, lie.
I don't know, and I want to know the origin. I am definitely curious, and especially
somebody black mama. That's it. Somebody black mama was like, "Oh no, you in grown folks' business. You don't come in here trying to tell me that I'm a lie.
Right,
I'm grown.
Right, and that's it.
I don't know. It just became like disrespectful. I'm gonna ask my mama. Because you're right.
Yeah, that's something you don't say. Oh, don't put those. You a lie.
You a lie, and then if you calling me a lie,
not a liar. You a lie.
A lie. You a lie. Nothing about me is true. Nothing.
Okay.
My entire
being. That's bad.
Man,
you may as well go to your room. Don't even.
Yeah, that word still holds trauma for me.
I'm afraid. Before you go to your room, you might want to pass by the closet and grab a belt though.
So Mama and Granny, if y'all listening, I was just saying it so the people know that you don't say that. That's all.
Right.
I wasn't saying it for real in real life.
Oh no, that was good. That was
fun. Well, Dr. Kortney, thank you so much for playing a round of Don't Drop the Mic with us. I feel like we can go longer, but I think we've got more important things to talk about. And I am just so excited to hear all the wonderful things that you're going to share with us today. But before we get into the meat of the conversation, our listeners and Jan and I, we want to know more about just who is Dr. Kortney James. So can you tell us a little bit about who you are and what your roots are? Where are you from?
So, I'm a wife, I'm a mother, I'm a daughter, I'm a sister. I'm all those things that Black women are. And so I'm also an Army brat. So part of my childhood was spent in Germany and the other half was in South Carolina. I went to college in South Carolina at USC, Southern, not Southern California, South Carolina, the University of South Carolina. Yeah. Because some people still be like, oh, you went to, no, just South Carolina. And then I came to Atlanta after I graduated. So I've been in Atlanta since 2006. Where I started as a nurse here in Atlanta and then went back and became a pediatric nurse practitioner. I recently graduated over the summer from the doctoral nursing program at Georgia State. So I am now officially a nurse scientist. So that's kind of the Cliff Notes version of me.
Yes, I love it. How was that experience of being, an Army brat, of living abroad and moving around? And
yeah, so I think, growing up, I wasn't like aware that I'm being exposed to so many different cultures. But it really did shape, I would say it shaped who I am now and many of the perspectives and beliefs and ideals that I have, because our school was kindergarten through 12th. And although we were all children of people who served in the Army, my father was in the Army, we were definitely of all sorts of ethnicities and religions and, races. I mean, I remember being little and knowing that this man looked Black to me, but he played this like salsa music when he washed his car every Saturday. And I was so baffled because up until that point, every person that I saw that looked like me was American. They were Black. And so I learned that his name was Miguel and he was Cuban. And I learned all these things about Cuban people and that they can look like me. And, just growing up around Germans and people who were Portuguese. And I mean, just so many different people. And that was just my everyday life. And so when I came here to South Carolina, it was just completely different, for various reasons. I never had to deal with racism until I was in South Carolina. I mean, and Germany, as we know, was like the birthplace of Hitler. But growing up there, it was not a thing that people praised or followed like Hitler's teachings or ways. It was very discouraged, and we don't, we will never be there again.
From that history. Yeah.
Exactly. If you ever saw anything about Hitler, it was like in a Holocaust museum or something of that nature. There were no statues, and we definitely learned about Hitler and how all that came about, but it was not in a sort of reverent way. It was very much, we will never be here again. And so to come here, and it was just completely different. Of course, my tone of voice was different. My accent was different. I had never heard like, oh, you're cute for a dark-skinned girl, until like I was in South Carolina. And so it was just very different for me, in shaping my thoughts and beliefs. But all those experiences, I mean, of course, not everything in South Carolina was negative, but just all those experiences definitely shaped my thoughts about the world and just knowing that people are different and wanting to share those experiences with my daughter as far as traveling and seeing different parts of the world and stuff. So yeah, I think it was nice being an Army brat.
Well, I just want to say two things. First of all, I stand a cultured individual. So yeah, I love that. Number two, I think that I don't know if Yana would agree with me or not, but I think you will. You're the first person who is like, I personally feel like you answered this question in pretty detailed, or you gave a lot of detail, I think, for me. I don't know. We may have had one other person, but I appreciate that. Thank you. That's all. I love it. Really, because some people, and I know it's you when you answer that question about what your roots are, you can answer it however you want. Yeah, you answer it however you want. But just for you to kind of give a little more depth and detail, and anything going as far as talking about your childhood and things like that. I appreciate that. That's all.
Oh yeah, and I think my experiences growing up kind of explains why I am the way I am now. So I could go on, but I won't keep the people here all day.
We're not going to stop you.
Do you have any siblings?
I have a younger sister. So, how old is my sister? Child, don't give me the line. See, that word. I know we're 7 years apart. So I think she's 30. Or maybe she'll be 30. Look, her birthday at the end of this month. So she gonna shame the devil. So I think she'll be 30 at the end of this month. But yeah, so that's it. It's just me and her, and we are like night and day, but we sisters through and through, and nobody better not mess with her, except me.
Right.
I know that's right.
And yeah, so when we came here, so in Germany, we were pretty much like on our own. It was us and our parents, and we had to make our own support system. Well, my parents did, as far as support and stuff, because there was no family. Like, I remember our family here in South Carolina would literally ship us VHS tapes of like the Cosby Show and The Different World and Pee-wee's Playhouse. So when I came here, especially when I was in college, and we would have like outings with all melanated people, and they'd be like, "Oh, you remember Good Times? Oh, you remember this?" And I'm like, "No, I didn't. I never watched Good Times." And they be like, "Oh, I'm gonna take your black card. Like, you don't know Good Times." And so then I've always explained, like, I grew up in Germany. I didn't come back over here until I was like 9. It's not my fault. Like, I felt so bad because I didn't know Good Times. So I spent most of my adult life trying to catch up on all the shows that my family couldn't, VHS ship, tapes across the pond. To me, so I could still feel like, I was growing up as a Black American while in Germany. So
right.
The people want to know, did you ever catch up with the Evans?
No, I did not. Like, I'm briefly familiar, but I just did. Now, the Jeffersons, watched all of those. I'm trying to think of some other things. Like, of course, like Coming to America, things like that. Like, I was born in 83. So
okay.
80s things. Yeah.
Let me stop.
Yeah, but I can't go way back. People will go way back. So I'm like, no, I don't even know what you're talking about right now.
Right.
So yeah, the only one I'm missing is Good Times, but I'm vaguely familiar. So I think I get a little bit of a pass.
So you were born?
Go ahead.
No, I was just asking. So you were born in Germany?
My sister was born in Germany. I was born in South Carolina, but we moved to Germany. I think I was 1 or 2.
Oh, okay.
Question, does that give you dual citizenship, or because the most bases are technically U.S. soil? That's different.
Right. Okay. I did not have dual citizenship.
Got it.
That would have been nice.
Yeah.
Right.
So I could, be somewhere else right now.
I mean,
since maybe 2016, but
listen, we feel you on that.
So no, thank you for giving us a glimpse. I feel like I was watching like a little movie. I could see like you experience live through just you talking about it. So yeah, thank you for taking us on that journey.
Yeah, no problem.
But okay, let's go back to you mentioning that you're a nurse scientist. Come on, somebody. Y'all better give Dr. Kortney her props. So when did you know that healthcare was the route that you wanted to pursue in your life's work?
So when we came back to South Carolina, a lot of my family members had health issues. I remember like we were a very much extended family, was close family. Like I would call my great granddad like Papa. Like there was no like, oh, this is my great grandfather and this is my great aunt. Like everybody was aunt, uncle, Papa, whatever. And so I was very close with all these, generations of people around me. And so a lot of my family members had diabetes, high blood pressure, just different things. Like I remember giving my aunt her insulin shots probably when I was like 11 or 12. And going to all these appointments. And my great grandmother had Alzheimer's disease. So I would help, essentially babysit or watch her to make sure she didn't do anything to endanger her own safety. And at the time, I just looked at it as, I'm part of the family and this is what we do as family. Like we take care of each other. But it was also like a very nurturing and nursing thing for me to do. Because I was always curious about like, what is that medicine and what does that do? And, when the hospice nurse started coming to take care of my great grandfather, because he had cancer, I wanted to know like, what is this? Why are you doing this? And so I always say I was a nurse before I ever knew like what a nurse was. And so as I got older, I realized like, oh, well, I enjoy this, and this doesn't make me squeamy, or this doesn't make me nauseous, and other people get nauseous when they do this. And so I wanted to be a nurse because I really wanted to develop a bond with my patients. And sometimes in my exposure to healthcare, everybody that came and was able to sit in the home or sit and spend time and laugh and joke with my family members who had illnesses were the nurses. The doctors were kind of in and out. And so that's why I said, oh, I want to be a nurse. So in 2001, when I graduated high school, I went to college to be a nurse. And so it just kind of grew from there. I think I'm a lifelong learner. And so once I got my bachelor's degree and started working here at a hospital in Atlanta and just seeing, different experiences I had with my patients, because I worked here as a postpartum nurse. So I took care of mothers and their newborns. And of course, occasionally it would literally just be a mom and their baby, but often it's the mom, the father, the baby, the auntie, all these extended family members there to support and just like providing education and this bond that I would build with patients. I'm like, well, I want to be on another level. I want to be a nurse practitioner and I want to take care of these kids. And so I went back to school to be a pediatric nurse practitioner because I've always loved children. I felt like one of my rotations in college was an oncology unit for children, so children with cancer. And that just kind of touched me in a way that I had, it tapped into some feelings that I had never experienced before, which is kind of the catalyst for me, being a pediatric nurse practitioner. And plus, I always thought, oh, I'm going to have a lot of kids. When I get older, I'm going to have like 5 or 6 kids. And then I realized how much they cost. And I had one, and that was it. And so I figured as a nurse practitioner, I could take care of many kids. And so that kind of fulfilled that desire. But yeah, so I really went into nursing because I was just innately, I guess, a nurturer and caring for people. And so as a nurse practitioner, I would often, so I've been in primary care, meaning like a pediatrician's office where you would take your child for well care visits, but I was also an inpatient. So in the normal newborn nursery, just taking care of newborns and then going and speaking with the parents about any concerns that I had about their baby. And so, oftentimes I would go into the rooms and want to talk to the mothers about their child. And especially Black women would have questions about their own health. I remember one mom was like, well, I never had high blood pressure while I was pregnant, never had it before in my life. Now I have it after I've had the baby. And nobody's telling me why. I'm on these medications and I don't know why. Can you explain this to me? And so, of course, like I'm not her women's healthcare provider. So I don't know anything, in detail about what is going on with her. But I found that this would happen more and more often, that Black women felt a certain level of comfort in discussing things with me that they may have discussed with their primary provider, and maybe they felt like they were ignored, or they didn't like the answer they got, or they didn't understand how it was explained to them. And immediately, they would ask me and want me to explain things to them in a certain way. And so from there, I was like, let me go back to school so I can do research about Black women and get us some justice, some answers that we need for our voices to be heard, for our stories to be told. And one of those ways is by doing research. Because I felt like often when Black women are included in research, it's to be the comparison group. Like white women are this way and Black women aren't. Or white women do well in this, but Black women don't. Black mothers die more often than white mothers, things like that, but never to figure out why is that. It was just to say, this is the way it is. And like, who said that white women were the comparison group? And I felt like if there were more Black women doing research about us, then maybe we wouldn't be the comparison group anymore. Maybe there would be people who are more interested in learning just about us and telling our stories and figuring out how to better serve us as a group, and not just to, compare us to someone else and to kind of validate the statistics, so that was part of the reason why I went back to school to get my Ph.D. so I could do research that was, for us and by us and about us and all that good stuff.
No, thank you so much. There are so many things that you said. I was trying to take some notes so I can make sure I touch on those. But first and foremost, again, thank you for seeing that need and actually stepping in to step up to fill a void that's so needed in our communities. And I know that is something that is so common, because I know just from my own personal experience, when I'm sitting in a room and especially a Black woman, female healthcare provider, as a doctor or nurse comes in, is I don't know. I can't explain that feelings, this internal, she don't know what is going on with me yet, but she knows me. I feel like there's some deeper rooted connection. The external environmental factors that are typically faced, and the different struggles, the different access needs. And I don't have to go through this whole process of explaining not only my symptoms, but explaining my, experience as well, so that you can I don't know if that makes sense, but it's just
that definitely makes sense.
It's I feel seen. She ain't seen me yet, but I feel seen.
Right. Oh, I see you. We see you. Right.
The other thing I wanted to say too was I admire your lead into healthcare. You took time to process and knew I want to be on the front line. I want to, deliver that care firsthand. Not saying that doctors don't, but like you said, it's a little different from how nurses are always by your side. When you page, and that's the first one that's going to show up usually is your nurse. And I hate that sometimes there's a stigma placed that if you're not a doctor that, don't get me wrong, doctors deserve their props too, but that doesn't mean that you guys don't have the same level of knowledge to care for an individual too. So, and the fact that you led with, I want to be first hand in delivering care, and I'm just going to continue building up on that and, expanding my research. And not only because you are on the front lines and you do have that such close kind of proximity relationship with your patients, you're on the ground, you get to hear, you get to see more often what those needs look like, to know where you are now, I want to research in this area. I keep seeing gaps here. So I just wanted to commend you on that. I'm sorry to take all your time, but that's all.
Oh no, just that, we all need those little nuggets that, of reassurance that kind of empower us and motivate us to keep on going. So I appreciate all your support and kind words like that. That gives me a little energy to keep going. That's why I do what I do.
I got more because I couldn't do. I couldn't get past. Me and Terry about this all the time. I couldn't get past chemistry with them balancing equations. So I commend you just for that alone.
Listen.
Don't take me back. I remember.
I made it past chemistry. It was physics that kicked my tail, and I was like, you know what? Y'all can have this.
This ain't for me. I don't have. Lord, I guess my life work ain't physical therapy like I thought it was. So.
No. I'm going to piggyback off Yana too, and just say, my experiences having children and yeah, the nurses were the most memorable part. They were with you the entire time through labor. And even when you were, going through your well appointments and, doctor come in for 5 minutes, look at you and leave. And, the nurse is there by your side, checking up on you, throwing a blanket on you if you need an extra blanket.
Man, you need some ice chips.
Right.
My nurse from my postpartum experience.
I love it. I had my first labor and delivery. My delivery, I had a traumatic experience, and we'll talk more about that later. But and then I did suffer from postpartum high blood pressure after my second child, and I was like, nobody told me nothing. What is this? But anyway, like I said, we'll talk more about that later. But I do. So yes, I appreciate the work that you are doing, especially for Black women. Thank you so much for standing in the gap for us. It is so appreciated. And I want to know, for you, when you were in nursing school and going through the process and all those things, how was that journey for you in particular, being a Black woman and getting to this place in your career? What was your experience like?
So I would say, I've been back to school 3 times. So each experience was different, not only because there were different professors and things like that, but also that I was at a different point in my life with each one. Getting my bachelor's, I was a young, single, early 20s, like living my best life, and I'll show up to class as well. It was like, I'm going to take advantage of all these Greek parties and I'm going to live it up. And I'm also going to pass these classes. But I was just in a totally different mindset. Like I was free from the house, but I also wanted to fulfill, my desire to be a nurse. So I honestly, I was in college and undergrad, I was really figuring out who I was. So my Blackness and all that good stuff in relation to the rest of the world. So it was great. Like University of South Carolina had the largest percentage of Black students than any other PWI in the nation. So I often felt like I was in my own little mini HBCU because I could go to all sorts of events and gatherings, and it was just Black people. And I loved it. And granted, it was not an HBCU. We did not have like an amazing drum line and homecomings, and that was just amazing. So I'm still trying to grapple with that. But it did shape, I think, my just desire to know more about Black people and their experience. For my master's program, it was very different. I'm trying to remember if I ever had a Black professor in my master's program. I really don't think so. And it was a program that was built for people who are already working as nurses. So oftentimes the classes were at different times and I really wasn't on campus a lot. So it was a completely different experience. And I do remember often feeling discouraged or asked like, well, why would you even do this? Because you don't have much experience in primary care. It was very hard. Like I remember being discouraged a lot by different professors. And then I had my daughter in the midst of trying to finish up a master's program. And at that point, it became, no one is going to discourage me from doing this because this is the way that I can provide a better life to my daughter. So no matter how hard this exam is, I don't care if I'm up until, 1 a.m. once my daughter falls asleep so I can study for this exam tomorrow. Like that's what I'm going to do. And so I remember like I was literally in tears on graduation day because I did it despite all the discouragement. I explicitly remember a professor telling me, you would not have passed this exam if I didn't give you the 12 points you needed. You would not have even graduated. And I said, at first, imposter syndrome can be real. Like, okay, well, I wouldn't have even passed this test if she didn't give me these points. So do I really belong here? But, I feel like my ancestors were in my head saying, but she didn't just give you those 12 points. Didn't she give those to everybody? And so I asked, I said, well, you gave the 12 points to everybody, though, because overall, people had issues with those questions. And the majority of the students got those questions wrong, right? And so she was like, well, yes, but you would not have passed if. And I said, well, it sounds like a lot of people would not have passed if. So maybe the questions are worded a little tricky. Yeah. You know, because I had it. I had it up to here and there. And so, you know, it was just like, let me get finished with this. But I would say my doctoral experience was completely different. I was surrounded by a lot of Black female professors who saw value in my work and supported me. And I think I'm very fortunate to know and to have a lot of friends who are also Black women who have PhDs that were very supportive and didn't minimize my desire to learn more about Black women and our experiences. I was very much uplifted and motivated. I got several different scholarships to pay for my doctoral education, one being the Southern Regional Education Board, which main goal is to pay for the tuition for Black and Brown doctoral students so that there can be more Black and Brown professors to support Black and Brown students. And we would have a yearly conference, and I kid you not, it was hundreds upon hundreds of Black and Brown doctoral students who were interested in learning more about us and putting forth our stories in a way that wasn't told by other people. So when you say that, so Tyrion, when you said that when you saw a Black provider, you feel like I am seen, they know me. So every year when I went to that conference, and it was hundreds and hundreds of other Black and Brown, you know, male, female doctoral students, not only did I know they understood my struggle and could have come into the same situations where they were being discouraged by professors, but I also knew that we were all in this to give back and to tell our stories. So it was, I mean, my doctoral program and the experiences around it was amazing, because you're not only doing this for yourself, you're also doing it for your community and for, you know, Black women. So it was, because if you do something for Black women, you essentially changing everything for Black people, because we are mothers who then go on to raise children who then go on to change the world. So I just literally, I felt like the future of many people is on me in doing this work. So it was amazing, honestly. It was very fulfilling work to do.
That warms my heart just to hear that your experience was so well. Actually, that was Jana that said she felt seen by her providers.
But you did.
Well, my story is actually a little, it's not janky, but it has an interesting little plot twist.
Yeah, we'll get to that in a moment.
We'll get to that later. But yeah, that was Jana. But that warms my heart though, really, just to hear that your experience has been really positive. And I think that also, in some ways helps to keep you, once again, motivated to keep pushing, to strive to be able to get into these programs and the research. You know, it keeps you fired up and motivated to keep pressing on. Like you said, to be able to help not only just Black women, but Black people overall advance and be healthy. So I love that. I love that. That's awesome.
Yes. And while we're kind of on that subject, let's kind of talk a little bit about your doctoral studies, your dissertation. I know your dissertation explored the racial identity of Black mothers and its correlation with their maternal functioning, postpartum depression symptoms, and bonding with their infants. Can you shed a little light on this research and how you apply the research within your own practice, as well as, you know, educating other fellow practitioners?
And so when we talk about racial identity of Black people, it basically means how you feel about the fact that you are Black in this country. And so there are very different types of racial identities. And so some people are very Afrocentric. They love being Black, and there's nothing you can say about a Black person negatively in their space. And I'm sure we all know people who are like that. And then we have people who hate themselves because they are Black in this country, and everywhere in between. There are different identities. So there's an identity called multicultural, where people love being Black, but they also respect other ethnicities, basically other groups that are present in this country, whether it's their ethnicity, their sexual orientation, their gender, their religion. You know, they love being Black, but they also respect differences and appreciate differences in other people. And so previous research has shown that whatever type of racial identity a Black person has directly sort of has a relationship with their mental well-being. And so it almost seems intuitive that a Black person who hates being Black would have higher levels of depression. And then, you know, people who feel like they need to assimilate with the dominant culture. So that would be Black people who feel like they need to adapt to, in essence, white culture, if we want to say white as a culture, but white beliefs or ideals like the American dream, things like that. Mainly my interest in doing that research was that the national average of postpartum depression in this country is anywhere from 10 to 23% of new mothers. But as we all know, Black mothers may not necessarily be heard during their visits. Mm-hmm. We deal with all sorts of things, whether it's racism, whether it's meeting the expectations of everyone around us, maintaining everything that we do while maybe struggling in various ways and adapting to motherhood. I was just interested to see if there was a relationship with our racial identity and our postpartum depressive symptoms or our ability to function as a mother. And so that was my research in looking at that. And so what I found is, one, that the mothers in my study had a higher, I don't want to say rate, but there were more moms in my study that were affected by postpartum depression, that had postpartum depressive symptoms, than the national average. So 29% of the women in my study had symptoms of postpartum depression. And then I found that the mothers who hated themselves because they were Black were more likely to have postpartum depressive symptoms. And that surprisingly, the mothers who assimilated with the dominant culture or dominant race in this country with the white race had a higher level of mental well-being than any other racial identity group in my sample. And so that was kind of shocking for various reasons, just based on findings in previous studies that showed otherwise. And then it kind of encourages you to figure out why is that. So that will be my research, long term. But my main goal was to see if there was a different way to assess postpartum depressive symptoms in Black mothers. Often the tools that we use are created by white scientists. One of the most common tools, the Edinburgh postpartum depression scale, was actually developed in Edinburgh, I think it was Ireland. So clearly that was made for white women with typical psychological symptoms of postpartum depression. So excessive crying, feelings of worthlessness, possibly harming themselves or their child, not having the motivation to do anything. Symptoms like that, where research has shown that mothers in various countries of Africa have physical symptoms. So while they may not, cry uncontrollably, they may say that they feel like there are ants crawling in their head or on their neck, or they have certain different types of pain. Their signs of depression may present differently than the, I guess, Eurocentric idea of depression. And so that is what I was also curious about. So there may be a reason that those mothers who assimilated or who assimilate with the dominant race in this country had a higher sense of mental well-being because they are similar to the people who designed the tools in the first place. Mm-hmm. And so those who do not, those who are Afrocentric, who are very proud of being Black, they may have different symptoms of depression, or that tool may not work as well to find depression in these mothers because they experience it differently. So it really just, my research kind of opened a can of worms for me to try to figure out, going forward. But in order for us to, the 29% of those moms who had postpartum depressive symptoms who never received treatment, whether they asked for it and did not receive it, or were told they did not have it, or did not feel empowered to disclose those symptoms with their provider, someone needs to be able to figure out that they are experiencing depression in ways that resemble the way they're experiencing it, and to help them.
No, that is man. I had a question.
It was a long study, so it's a lot to try to,
I feel like I'm not Ph.D. qualified, but I at least I should get a certificate.
Crash course.
Right.
I don't know if I missed this part, or if you said this. If you did, I'm sorry. For some reason on my end, it kind of went in and out. So I hope that everything was okay. I think y'all said, Terry said you heard everything.
Yeah, I could hear everything.
It picked everything up. Maybe I'm just having some issues. But one thing I wanted to ask was, in your research, did you find anything that correlated with generational traumas, especially as it relates to Black individuals in your research, like how that can translate into a lot of the depressive symptoms that we may have?
That's a really good question. But no, I did not kind of delve into the various factors that can result in Black women experiencing postpartum depression. Eventually I will get there, but that was not included in this study. But it's a very good point, and definitely can affect our mental health.
Mm-hmm, definitely. Let's talk about the Superwoman persona. Can you explain to us what it is? We're familiar with it, but for our listeners, can you explain what it is and how does it relate in particular to the mental wellness, illness factor that's unique to Black culture, which ultimately creates unrealistic expectations for Black mothers?
Mm-hmm, definitely. So, first of all, it's important to know why this kind of persona began, that Black women are super women. And it was really created to kind of counteract all the negative stereotypes associated with Black women. So the mammy stereotype, or the Jezebel, or the welfare queen, welfare mom. I don't remember who started it, but the Superwoman persona was started to show that, we're not these negative stereotypes, but, Superwoman persona is a stereotype in itself. And it kind of means that Black women can be all things and be everything to everyone, even to their own detriment, that we can do it all. And so Dr. Woods Giscombe kind of did some research, she did the research, she's a Black woman, did research about the Superwoman persona to try to describe what that is to Black women, so that we could figure out how it affects our health. And so when we think about poor health outcomes, whether it's pregnancy-related death, high blood pressure, lupus, just various different health conditions are a result of chronic stress. And so one of the things that can lead to chronic stress in Black women is the Superwoman persona. And why is that? It's because, you know, you still try to do everything despite what you're going through. And eventually it can affect our mental and physical health. And so that would be a cultural aspect for Black women that is unique to Black women. Not all women of various ethnicities, you know, feel the need to be strong regardless of what they're going through, does not feel the need to suppress their emotions so that they don't become a burden to other family members. You know, just these different ideals that are associated with the Superwoman persona. And because we load all these things up, or culturally are supposed to be the strong one in the family, it could, you know, lead to negative health outcomes. It could lead to essentially the breakdown of our physical and mental health. And so I feel like it is important to explore this in Black women, because it could explain, you know, why we have such adverse or such poor pregnancy related health outcomes, whether it's premature labor, whether it's low birth weight babies, whether it's pregnancy induced high blood pressure, just different things. Because stress, whether it's caused by the Superwoman persona or stress because we experience racism day in, day out, whether it's at work, whether we go to the store, whether it's being exposed to everything on, you know, these various news channels all day, every day, you know, it does affect our levels of stress, and we are still expected to do everything that we do regardless. And that's just part of our culture. And so it can affect our health. And so I feel like we need to explore that more. Not that it's our fault, you know, not that, oh, Black women try to do everything and that's why y'all are the way y'all are. It's not placing blame at all. It's just to better understand how we deal with stress, what causes our stress, and how to better care of ourselves, create interventions or, you know, programs, different things to lessen that burden, essentially.
No, it was something that, gosh, I lost my train of thought, that you mentioned. I should wrote it down. Did you have something?
No, I mean, once again, you were really breaking stuff down for us, and you know, it's one of those things like we being Black women, we're aware of these things, but then they get the academic side of it, and you really kind of laying it out even more in detail. Is
and sometimes too we don't link the things together, like, these things really like build upon each other or correlate in some way, like this is a direct reaction of this. And
absolutely,
I think that's a lot of what, you know, not only for us, but I feel like those who don't live this experience, who are not Black women, to illustrate that story. Because sometimes if it's not spelled out in research and academics, it's not validated in a way. Although we as women and Black women can tell you what our experience is like, it's sometimes we still get this. Terry, we were talking about this the other day about.
Yeah, it's the actual word is passing me by right now.
Ethnocentrism. I don't know. That might not be.
Yeah, but just basically people just trying to qualify your word. And basically saying, oh, when it comes to especially Black academia and research, and if a white counterpart is reading a book authored by a Black person or academic work, then they try to qualify it by being like, oh, this is really well written, or this is really well researched, or you know what I mean? And it's like, at the end of the day, regardless of the research or whatever information I put in this, like a lot of these things are just true in general to our experience. My experience should be valid enough for you. But unfortunately, y'all don't ever believe us when we tell y'all stuff. So I got to put it in an academic research paper or, you know what I mean? I've got to do all this extra leg work to make sure that you understand what I'm trying to tell you is going on in our community, which sucks, but you know,
and sometimes
rise to the occasion and do what we need to do.
Yeah.
Right.
And sometimes there's countless. I'm sorry. Go ahead.
But, you know, to your point, Yana and Tyrion, is that part of wanting scientific evidence is helpful, but it also cannot be helpful. So just to draw similarities, like with everything going on with coronavirus, if somebody just says, oh, if you sip hot tea all throughout the day and blow your nose 50 times, that will protect you from getting coronavirus because it protected me. Like if somebody were to say that, right? We could say, oh, well, that's her experience and she doesn't have coronavirus, so we should all do that. But academia and science will say, well, first, before everybody go and do that, let's actually do a study with 500 people and see if when they do that and live their life how they've been living it, if they also get coronavirus or not. Right. And so part of it is that, yes, your experiences are valid and I mean, real, but it could be a coincidence. It could be, oh, well, that happened for her, but it doesn't happen with all these 499 other people. So is it really valid? And so again, that's why I felt the need to be a nurse scientist, because like you said, like you both said, we all know whether we out having our sister girl brunches or it's like, okay, let me call my homegirl so I can vent about what just happened to me at the doctor today. Like we all know that these experiences are real and they're not just a coincidence because they happen to more than just us. But until there is enough, unfortunately, until there is enough evidence to show that this was not just a, anomaly. She was not just the exception to and a victim of the healthcare system. Like this is what is happening. You're right. Nobody feels like it's necessarily true. It's anecdotal. It's not, based in science. And so that is definitely why I do what I do. Because really, I'm just giving all the women who have vented to me or shared their experiences a voice. And I just happen to have Ph.D., at the end of my name and know how to make my research strong so that if, like you said, a counterpart or someone else tries to come through and tear through why I said what I said, or can we really say racism is related to these poor health outcomes, I can say, well, I took all these measures to make sure that the other confounding factors didn't influence my outcome. Only I can do that because that's why I went to school. But I'm really just being your voice in a different way. I'm just telling your stories in a different way. So I definitely understand your point and your frustration. And it's definitely way past due. Because for the longest, a lot of poor health outcomes of Black people were always attributed to, income, lack of education, lack of healthcare access, and all these various things. And there are many different programs and, interventions to address those. And yet still our health outcomes are poor. So it's not just that Black people don't have all this education. It's not just that Black women get, pregnant younger, not even that these things are necessarily accurate, but forever things have been attributed to our own experience. Like, well, they live there, that's why, or they don't have good insurance, that's why. And even if we have all of those things, even if we are, as Black women, the most educated, high income earning, have access to healthcare, have good insurance, we still die more than other women in childbirth. So, and why is that? So it's not just that these social determinants of health that they call are affecting us. It very well could be what you all are saying that we experience, is different various ways we experience racism, whether it's at work, whether it's just going to the store, whether it's our healthcare provider minimizing or ignoring our experiences. Like, we must be heard because our experiences are real. And this is truly affecting our health. So yeah, I hear you loud and clear. And I wish we would have been heard a long, long time ago. Maybe we will be in a better space now.
Yeah.
Yes. But, like you said, things are changing. And part of that change is because now we're taking on those reins, like you stepping in and like, I need to do this research. So sometimes we are our own advocates. We're our own ones who pull us out and get it out. So yes, I appreciate that there is some movement of the needle. But of course, with everything, there's always more that can be done, more work that can be done. Before we get ready to wrap, I did want to just touch on, we talked about your dissertation and then we talked about the experience from just being Black women and seeking healthcare. Can we talk a little bit about, which is a valid thing, the lack of trust that historically that not only just Black women, but Black people in general have when it comes to healthcare and seeking healthcare, and how we can move beyond, really being more proactive with our health, as it relates to just in general, as well as us being expectant mothers, because we know that, the maternal mortality rates for Black women, especially in the U.S., are like, man, that's a whole talk itself. How can we, move beyond, that piece of, I guess removing this layer of like
distrust.
How do we learn to trust? How do we learn to put our faith back in the healthcare system, basically?
And become our own advocates.
Yes. It's kind of difficult because based on our history in this country, as Black people, of course, we have been, affected by or victims of unethical medical treatment, from the Tuskegee experiment and even further back, OBGYN gynecologists doing experiments on Black women without sedation to figure out, women's health things. I mean, just very inhumane treatment. So there it is, just in Black people not trusting their healthcare provider. Not only the historical piece, but like you all have said, you go and you disclose things and you try to talk to your provider and you're not heard. So it is, as a healthcare provider and a researcher, it is hard for me to just say, well, we need to participate in research so we'll know more about ourselves. Or, you need to trust your healthcare provider so you can get the things you need. Because it's definitely not that simple. And, in my perfect utopian world, all of our healthcare providers would look like us and understand us and be our advocate. But unfortunately, in 2020, we are in a place where we have to be our own advocate, which is, honestly, it's absurd, because while I am a healthcare provider, I don't know every healthcare thing. I have a particular specialty, and that's what I know. So for someone who whether you're educated or not, if it's not in healthcare, how could you really know if this is the best treatment for yourself? You may know that you feel bad, and even after you went to the doctor, you still feel bad. But would you know that it's because you didn't get the right treatment? So just a short story. My sister, who I told you all about, is younger than me, and she had her son a few years ago when she was 25. It just so happened that we had snow here in Atlanta. And so you all know the city shuts down, and I couldn't get on the road when she was in labor, and because she's still in South Carolina. And so I'm literally on the phone talking to her while she's laboring and while she was at the hospital. And she's 25, her first child, absolutely no issues whatsoever. But the only issue was that it was Friday evening. And so her doctor insisted several different times that she needed a C-section. And had I not been on the phone to really ask, well, what do you mean she has a fever? What was her temperature? Oh, it was 99.8. Well, that's not a fever. So she doesn't need a C-section. Well, the baby's in distress. Okay, well, let me see the strip from the fetal monitor. So now, granted, I don't really know how to read a strip, but I was gonna fake it because I'm like, my nephew is not in distress over there.
Yeah.
But they don't know that I didn't know. Now, granted, if he really was in distress, I wouldn't have, questioned them. But it just felt like it was a reason after reason after reason why my sister needed a C-section. And I'm like, she does not need a C-section. And really, it was just that he wanted to be able to deliver this baby so he could go home for the rest of the day and go to sleep. Wow. Now, this was a white male provider. And of course, all physicians do not act this way. All healthcare providers do not act this way. But in this instance, this person did. And if I had not been there on the phone with my sister every time this man came in the room, she would have felt like, okay, I need to have a C-section because my baby's life is in danger.
Right.
She is not educated in that way. And everyone is not. Everyone is not a healthcare provider to know, no, I think I'm fine. I don't need a C-section. So it's really absurd to expect us, the patient, to know what's best as far as healthcare and their treatment. I'm just as frustrated as the rest of the Black women, Black men, Black people, brown people in this country who are ignored. And I really don't have an answer on how to progress, except, I guess, one feasible way, since, like I said, we all can't, go to school and become healthcare providers so that we can take care of ourselves, although more of us should, so that we can take care of each other. But it would be a lot of what is going on now is to face and call out acts of racism or acts of discrimination, or call out the fact that Black women need to be listened to and we need to be heard. Because I think often things are kept quiet or swept under the rug and nothing is done about it. So the only way to address it and resolve it is to continue to call it out, and not just allow it to continue to happen. And then, as a Black woman, I often feel like saying we need to train these people to be aware of their biases and aware of their prejudices so they don't do it anymore just seems very elementary and very like we are way past that at this point. Because part of me feels like if you're ignoring people, you kind of know that you're ignoring people. So what kind of training would we do?
Right.
But I guess that's the PC thing to suggest. But I also think the real solution would be to dismantle the entire system of oppression and racism, which would take far much longer than, a training class.
Yeah.
Because it's kind of built into the system.
Yeah.
So I honestly don't know how we move past this, except to continue doing what we always do, which is to speak out against things and don't feel afraid to try to find another provider, which, depending on your insurance, depending on where you live, depending on various factors, there may not be another healthcare provider and you're stuck with this person who will not listen to you. So I honestly, I wish I had better solutions. But for now, that's where I am with it. And if you have somebody who can be an advocate for you that is knowledgeable about whatever you may be experiencing, or even if it's not someone who's necessarily knowledgeable, but someone who is not afraid to be in that discomfort at the office. Because, you know, sometimes if you're in a doctor's visit and it's just you and the provider, and if you're like, well, no, you told me to do that last time and it didn't work, like I still feel this way. Some people are not comfortable in that confrontation. So my sister is younger, but she is definitely like, she does not play. So, and I'm very non-confrontational. So if I wanted somebody to be there for me to speak up, even when I feel uncomfortable, she would be that person. Which is interesting because it was totally opposite when she was having a baby. But, you know, just having somebody there to be like, well, no, you did not answer her question, or no, I don't appreciate your tone that you had with her.
Yeah.
And no, I'm gonna need her records so we can find another provider. You know, it's just really hard to be a person who needs healthcare and needs attention or needs treatment, but you also have to sit here and fight and argue and be your own advocate. It's exhausting. It's exhausting, but we just have to keep speaking out against it, and hopefully change will occur.
Yeah. I want to ask you something, and this might have to be an off the record, so we may have to take this part out, but I do, just because we're kind of we're talking about this right now, and this plays a huge part of my story. Do you think that, and I'll explain why I'm asking this, but do you think that kind of earlier when you were talking about how, you know, you even got these different sects of Black people, Black folks, of how they identify themselves. Do you think, or have you personally seen within the realm of healthcare providers where there may be Black physicians who unfortunately have fallen into the grip of white supremacy and just believing all the lies, and so unfortunately they're not offering the best healthcare for you as a Black person? Have you seen that before?
Now, I will say, I'm sorry, go ahead.
No, go ahead. I'm sorry.
No, I will say that I have never personally seen someone ignore a provider because they have kind of assimilated or adopted the ways of white supremacy. I will say that medicine in general, research in general, was tailored to kind of help white men or than white women. Like Black people were not always at the forefront of, oh, let's figure out this treatment that works for all people. It was more so, let's figure out this treatment that helps white men. And so I don't know if y'all are heavy on Twitter, but I've recently been introduced to Twitter. Not recently, but it's been a while. But there was a lot of talk about how just in medical books and how you learn is based on white skin. So even skin conditions, you know, if Black people have it, you don't necessarily know what it is because all the pictures were of white skin. Yeah. And so I don't. Now, true, there very well may be providers who don't want to be Black in this country, so they feel like they need to assimilate with white supremacy or whatever, and may mistreat patients. I have not seen that, but inherently there is, you know, white supremacy throughout medicine based on how it was founded and began. And so, you know, there is still that culture present. But like I said, when there are more people who look like us, who want to be our advocate and do right for our community, you know, hopefully that would get better. But no, I personally have not seen, I'm trying to think, but not, I will say sometimes if you're going through rounds, or if you're going through, I want to, like if you're in class, if you're an intern, or if you're in clinical rotation, and the person who is your mentor has those ideals or feels like, oh, here's another person coming in here seeking pain meds. Like they're probably not in pain, like underestimating Black people's pain, or underestimating what we're there for. That could rub off on you, or because this person is essentially your superior or your boss, you may not feel comfortable in saying, well, this person actually has sickle cell and we don't need to underestimate her pain. We should help her how she needs to be helped, because again, you're having this confrontation and it can be uncomfortable.
Right.
And so now I am aware of that, where your mentor can relay like, okay, I need you to go in and see this patient. Tell me what you think. It's probably just that they want pain meds, or it's probably not that serious, or we're not going to admit this person, but let's just go ahead and assess them to make them feel like they've been seen or whatever, and we can get them out of here, blah, blah, blah.
Yeah.
Like that can happen. And people can be put in very compromising positions. And if you're not careful and if you're not aware, then that would become your own culture in caring for people. So that's definitely an issue.
Well, I think the reason why I asked was because I did have with my first daughter, I had a Black physician, and she was, honestly, she was wonderful. I liked her very, very much. She did not have any issues. Literally until, this could have just been honest to God, a fluke type of situation. But labor delivery's fine. I deliver my baby. And then I start to bleed out and we suddenly, I don't know if things just started kind of going out the window. I don't know if it was because it was kind of a frantic type of situation. They can't stop me from bleeding. She's asking me all sorts of questions. And I'm thinking to myself, these are questions that should be in my file and my chart. You've been caring for me for the last 9-10 months. Like, you should know these answers. Why are you asking me this? I'm laying on the table, cold, legs in stirrups. Like I'm about to meet Jesus here in a minute if somebody don't fix this situation. And another healthcare provider happened to be walking down the hallway, and I don't know if somebody kind of pulled her in and said, hey, this is going on. And she knew immediately what to do. And they were able to get me to OR and stop the bleeding and all that. But I was kind of like, it scared me so bad. I was like, I don't want even, like, I'm going to have to find somebody else. And I was like, I didn't want to do that because this was like, Yana knows where we live. That's hard to find a Black healthcare provider. And I was so saddened, I think, by the situation, because I was just like, what is going on? I remember, and my sister-in-law is an OBGYN. I remember like telling her what happened. She was like, oh my gosh. She was like, when that happens, like, we know instinctively what you're supposed to do in that situation. Like the fact that she didn't pick up on that, she was like, that was just odd. And so, I did end up finding someone else. That was great. They weren't Black. And I hate that because like Yana said, it is something about having Black physicians. Growing up, my pediatricians were Black. You know what I mean? Like my dermatologists, my eye doctors were Black women that I went to growing up. And I wanted that same experience as far as being a woman in my healthcare and for my children. Just the area we live in, that, like I said, that was hard to come by. So when I found it, I was like, man, we're going to hop right on this. And then I had a bad experience. So I was, like I said, that was kind of more of an off the record. And I was just trying to, I just wanted to ask you that to see if there was.
Oh yeah, that's no problem. I hate that you had that experience because, I can't even imagine the fear and just the panic and especially like having a baby, and then you're thinking, am I going to be able to see my baby? Like,
I didn't get to bond with her.
On my way out of here?
They are like rushing me out of the room, and I was like, I felt like I was on an episode of ER. Like, running down the hall.
Imagine.
Yeah.
But your relative, your cousin, I think you said, who is an OBGYN, is absolutely
my
right.
sister. Yeah, my sister-in-law.
Yeah. Sister-in-law. Absolutely right. I'm not even an OBGYN. I was, a floor nurse in postpartum and in mother baby. And I've had women, have what's called a postpartum hemorrhage when they do bleed out. And I know like what we need to do, that I can start initiating on my own, like IVs and Methergin and all this stuff. And if that doesn't work, we need to get her back to the OR because there's some placenta, or if you're a C-section, there's an artery that was probably nipped. So I don't know if
apparently
experience on her behalf.
I think it may have been. She was fairly young and from my understanding was fresh out. They told me that my what is it? The top of your uterus, what is it? Fundus or something?
Your fundus.
It collapsed.
Mm-hmm.
And so that was, and my sister-in-law was like, usually they know to kind of put a fist in you. Sorry to be great.
Right.
They put a fist in you.
You
and
don't have to be sorry to me.
To help with that situation. But anyway, I didn't want to take up anyway. I was just curious from that experience and just,
I've definitely dealt with that to the point I literally like had my fist. I felt like I was going through somebody's back, like, trying to get their fundus back firm,
right?
Because you will definitely bleed out. So that was an experience. But I mean, I was probably 22 in there. Thing. So that's unfortunate though. That's scary.
Yeah. Oh yeah. Had to have blood transfusions, everything.
I know you did.
First of all, I'm over here. I don't know if you saw my mouth this whole time, Terry.
I didn't even look over at you.
When you think you know a person, I don't remember that at all.
Yeah, that was with Zoe.
I was scanning the calendar in my head, like, where was I in the world when she delivered? You said Zoe?
That was with Zoe. Yeah.
Yeah, I kind of somewhat remember you having complications, but I guess I don't remember the details.
Yeah, and I think when Dre had maybe after she was born, and Dre texted maybe my dad or something, he just said pray. I think he had maybe asked everybody to pray for her because she was having complications, and I don't think we ever went back and really into detail about what happened. But
because that's traumatic in itself.
Yeah,
reliving. Yeah, so you like, hey, we made it through. It takes a while to talk about.
Man, and then it was like, okay, do we want to have another kid? And I was like, if that's going to happen again, I don't want it. And I remember telling my new healthcare provider, I was like, listen, this is what happened to me. Can you make sure this does not happen again? And she said, I promise you, I'm going to do everything in my power to make sure that this is the most uneventful pregnancy, labor, and delivery. And thank God that it was, besides the fact that I ended up having postpartum high blood pressure. But other than that, like the experience was, I was like, oh, I could do this again after I had Autumn. I was like, oh, that's how it's supposed to be.
Right.
I'm happy that was much better because child.
Yeah, mine were fairly good. I had for my first one, I had an instance with what is it called? The epidural didn't take the first time. Yeah, that was that. That was that issue. But the second time, I actually had a Black physician. She's my OBGYN and gynecologist, but I love her. And like I said, it was just a different experience with her because, like, she knew a little bit more about our journey and our experience, and she would really have talks to me because I was still working and doing things, and she was like, no, she's like, I see the stress in you, and she's like, I'm going to put you on bed rest. And so she she was
good looking out sis.
Yeah, she was very proactive about making sure, like, no, you send this. No, I don't care what they say. Or they got you doing at work. No, you put
sat down somewhere
stress on this baby. Right. I can see this. She's like, it's not necessary. I can see the direction that this is going. And she wrote me up some real quick, and she was like, I would call them and to make sure that you are home. And I was at home for 12 weeks. I believe.
Wow.
And that helped me tremendously. I was like, oh Lord, I ain't know that this was possible. Thank you.
Right.
But the only thing, she wasn't able to deliver the baby because I call her stubborn, but she wanted to come when she wanted to come, and it happened to fall on the day that she was not on call. She was not on call that weekend.
Yeah.
So I had to get somebody, and even her, like, so their practice is her and another Black woman physician, and they both, you'll see, like, she was my primary, but they would each have a relationship with all the patients. So just in case one of them wasn't there, they would be their own backup, and they would be on call for each other. And I so happened to pick the weekend where she wasn't on call, and her
partner.
Her partner, I guess, had an emergency. So I had to go to their third person.
No.
And I had never met this lady. I was like, she had carried me this whole way. Yeah.
Oh no.
Oh man.
But the delivery was successful. It was good. But I really wish I could have went through the whole experience with her actually delivering a baby, because she, like, that experience, although I don't want to have Lord, I don't know what your plans are for me, but I don't. But yeah, she gave me so much joy just through that experience. Like, I was excited to go to my appointments and just talk to her. Even now, like, because she's my gynecologist too. She's it's such a different type of relationship. She knows me. She knows. I'm not saying that doctors don't have this relationship with their patients, but like, she knows my children. She knows, like, she really, truly, like, I feel like she looks out for me beyond just a doctor-patient way, but still, like, making sure that I'm being an advocate for my health.
That's amazing.
Yeah, I love that.
That's wonderful.
Give me her number, please.
I've been trying.
Okay.
Have you sent me her information?
She gets booked when I say, because
I probably won't be able to
get on a wait list then.
Right.
No, but yes, we can continue this talk, but I know we gotta let you go. So just a few closing things before we wrap for the day. 2020 has been a little different year for us, and typically we'd like to be guided, whether it's a power word or affirmation or something that gets us through the year. What would you, if you can name a word or two that would be your word for 2020, what would that be?
Oh, that's a good question. So, funny enough, I do that at the beginning of every year. Like, some people have vision boards. I have a word that will be like my theme for the year. And I guess 2020 was like, oh, I'm going to test her in this word. But it was perseverance. And just to keep, don't be discouraged. Don't stop. Whatever you have set your mind to do, like, persevere and do it. And so that is definitely like my word for 2020, because we know all the things we have faced in this year. My goodness, whether it's on a global scale, a national scale, local, personal. I mean, we have all been tested more so than I think we have probably ever been, as far as like national issues, global pandemic, the administration and all this craziness. But we just have to continue to persevere and get through this. And hopefully, it might not be tomorrow, it might not be the next day, but if we continue to persevere, we will make it through, hopefully, to better times, because this has definitely been a year to remember.
Amen to that.
We persevering though.
Right, we really are. We are putting that word in action for sure. Dr. Kortney, do you have any new works, anything new, interesting, exciting, research-wise, anything coming up this year?
I defended my dissertation July 1st, got married on July 11th, and I have been, I defended, but with revision. So even after I defended, I was still like doing some little edits here and there. So I said from August I said August I was going to relax, but that might kind of bleed over into September because I is tired. But I am looking for a postdoc opportunity so I can get my own research program started. So, when it's time for me to look for Black women to share their experiences, I will definitely, share that with you all and because you all have some experiences. Woo.
Oh yeah.
So I would, love to hear more about it and get that information out. So I'm sure I'll be sharing some things with you all in the future, and hopefully you can share with your audience to kind of continue to let our stories be heard.
Absolutely. And let us know. We'll put a call to action out there if there's, a way that we can get you connected with people that want to help with the study. Let us know.
Absolutely.
Wonderful. I sure will.
But I admire you. You got your paper and your ring in the same.
Right.
Not even with a week apart.
I said, I'm ambitious, I suppose. I think when you're in the midst of, again, the Superwoman persona, but I don't feel like I signed up for that. Yeah. Coronavirus actually messed up our wedding. It was supposed to be October 10th, so we could be like 10/10, 20/20. Perfect, I'm that sappy type person. So it really was not supposed to be all crammed in like that. But I just said, babe, I don't think because we're supposed to get married in Vegas. I'm like, I don't think Vegas is going to be open October 10th. So we need to kind of strike while we can. So we had a really, 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 really small wedding to the point they call it a micro wedding. It was like 10 people. And so it just so happened to be the week after I defended my dissertation. Because I said, well, 10/10 was going to be like a catchy date and it has meaning and it's, and so I figured 7/11 also
fair enough. Yes.
Yes,
so absolutely.
It was just a lot. And I, getting your PhD is one of those things where you kind of have heard that it's difficult and that there's only a small percent of the population of the world that has this, maybe like, I don't know, less than 5% or something. I don't know. But so it's difficult, but you never truly understand until you're in it. Like kind of like labor. Mm-hmm. People say, oh, it's painful or oh, blah, blah, but you don't really grasp that until you're in it.
Yeah.
And so I think beforehand I was like, oh, 7/11 is a good idea and I'll just defend by 7/1 and blah, blah, blah. And then I got in and I was like, I don't know what I did, what I was thinking, but this wasn't a good idea, Kortney. But I was in it by then.
But
so
you did.
Yeah, I just relax. I did. So now I'm done and I'm going to relax and then I'm going to get back on it.
Yeah, I commend you. I have some days when I wake up and I'm like, I'm going to go for it. I'm going to go and work on that with my doctor. Then I snap back into reality. I'm like, no, let me. First of all, somebody got to pay for me to go back to school.
Amen.
I'm tired of paying for school. But no, but yeah, look at man. You are all the things, Dr. Kortney. And we just appreciate you. Before we do wrap, can you tell our listeners how they can connect and plug in with you and plug into your research and all the work that you're doing?
Definitely. So, look, I need to remember my Twitter handle. I'm so bad about this. You would think I would know. So my Twitter handle is @K Floyd James. So I am my unapologetic Black self on there.
Yes, I'm going to follow you.
Yes, please follow me. Because, I feel like some people use Twitter just to brand themselves and to push out, this information. But I do that. But I also give you my true self and my thoughts on current events or whatever. I'm just me. So that is fun for me. But you can also, ask me things. I've made connections with different, scientists and hopefully we'll collaborate with some research in the future. So, I mean, it's professional and personal. So, and then I also have a website that's KortneyFloydJames.com. So I'm Kortney with a K, no U. So that's KORTNEY FloydJames.com. And it's just a lot of information about the research that I've been involved with. You know, anything that I will be working on in the future will be there if I need participants for research. And I also, whenever, you know, this podcast airs, I'll be linking that on there, all that good stuff. Because I have truly had fun with y'all, and y'all are amazing. I feel like we're like friends now.
Oh, we are. What you mean?
That's what it is.
So when outside opens up, like, we gotta hang out.
Absolutely. we got family out that way. My dad's out that way. Our aunts are out there. Our granny's out there. So that's not a problem.
We're good.
Yes.
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 Oh my gosh.
Thank you so much.
Thank you. I feel like you've helped not only us, but you've helped so many people that are listening to this, and just you just give us hope. This is what, man, these I ain't trying to start a whole nother conversation, but you know, it's just good to see Black women moving.
Say it.
So you keep moving, Dr. Kortney, keep shaking the tables.
Yes.
Well, y'all keep giving me the momentum to make the moves that I make. So I appreciate y'all.
We got you. We be a cheerleader. That ain't no problem.
Oh, because Black women can be some cheerleaders now.
Yes, indeed. Yes, indeed. Absolutely.
All right, y'all. Thanks again so much for tuning in and listening. And you know, as we continue to share our voices and amplify our stories and our experiences, again, our aim is to always amplify the beautiful voices of Black women, sharing our lessons and celebrating our successes. And I feel like we have successfully surpassed that today. So, so you guys, until next time,
melanate on that.
Thank you for tuning in. Hope you enjoyed our chat today. Keep the conversation going by heading to iTunes to subscribe, rate, and leaving us a review.
Have a story of your own to share? Email us at info@melanatedconversations.com or connect with us on social media at Melanated Conversations. Till next time, keep raising your voice.